on the local basis, you have what are known as health cities. 100 French cities are part of that network. Of course, 100 cities may not be enough, but it's already a start to prevent additional greenhouse gas emissions by a development of what is known as active mobilities, meaning people walking or cycling to work instead of using cars or public transportation. So you can see it, ladies and gentlemen, we are conducting this struggle on every front, here in France, but all around Europe. But what is required now is coordination between such efforts worldwide, and we need to have a clear framework. We need to have indicators so as to assess the effectiveness of these measures, but also we need to share tools, and that is the next challenge ahead of us. And after COP21, an ambitious, universal, binding agreement on health, and I do mean on health, will need to be sealed as well. Madame Neuville.
Thank you very much for addressing this side event. We very much appreciate hearing the perspective of France, in particular the long-term collaboration we are having with you, and especially in the area of environment and health, but in all areas you were just mentioning. So thanks very much. I have now the honor of introducing Dr. Zsuzsanna Jakab, our regional director. And before becoming the regional director, Dr. Jakab served as the founding director of the European Union's European Centre for Disease Prevention and Control, and has held a number of high-profile national and international public health policy positions in the last 3 decades.
Your Serene Highness, Prince Albert, Madame Ségolène Neuville, Secretaries of State, heads of agencies, outstanding scientists, dear colleagues, friends, ladies and gentlemen. First of all, let me start by repeating what our Director General Margaret Chan said yesterday in a similar event here. She said that climate change is a defining issue of the 21st century. It is a very important issue in the new development agenda, and this is a decisive moment for all of us. Governments and countries of the world are here together to finalize a universal and credible agreement with strong commitments to stop further deterioration of the change of our climate. This is critical to public health. We hope to see a strong people perspective and a public health perspective in this agreement, and of course, all the mitigation measures will have very strong co-benefits for health. The fight against climate change is more than just an environmental question. These were the words of the Honorable Minister Fabius, who was opening the conference. It is essential for nourishing our people, water on earth, safeguard biodiversity, protect our health, fight against poverty and massive migration, avoiding war and encourage peace, and giving a chance to development. Climate change has a serious adverse impact on human health, on economic prosperity, on political stability and societal productivity. And Europe is not spared. 70,000 deaths occurred in 12 European countries in 2003 as a result of the heat wave. It was this country which faced the highest consequences. Several thousands of people died within a week. Hospitals and mortuaries were overcrowded. Health professionals had no cure. Some of the dead persons were found days or even weeks later, highlighting some of the social dilemmas of our time. Experts anticipate that more of this is to come. The good news is that this agreement could potentially save many lives worldwide. Investments in low-carbon development, clean renewable energy, and greater climate resilience are also investments in better health. Let me give you a few examples. Measures that reduce air pollution as well as non-CO2 air pollutants, such as black carbon, can reduce the 7 million deaths globally and the around 600,000 deaths in the WHO European region. A reform of global energy subsidies could reduce carbon dioxide emissions by more than 20%, cut premature air pollution death by more than half, and raise government revenues by nearly $3 trillion. Implementing and enforcing higher standards for vehicle emissions and engine efficiency can reduce emissions of short-lived climate and air pollutants, saving around 2.4 million lives a year, and reduce global warming by about half a degree Celsius by 2050. Reducing the 4.8% of annual CO2 emissions of the European health institutions could further reduce 15 to 30,000 cases of illness. The good news is that regional initiatives can significantly contribute to global implementation. For example, the European Environment and Health Process provides an ideal platform. It brings together the Ministers of Health and Environment of the 53 European member states. It generated a protocol on water and health, action on transboundary air pollution, and pan-European initiative on transport, environment and health, what we call the PEP, and 3 ministerial declarations calling for further action on climate change and health. More recently, the Working Group on Health and Climate Change was created. As a result, 32 countries examined their vulnerability to climate change-related health threats, and 24 developed already adaptation strategies and plans, including health. Whilst most countries in the region took action to reduce greenhouse gas emissions, also reflected in the INDCs, more needs to be done to capitalize on the health co-benefits of energy, transport, buildings, and agriculture. Ladies and gentlemen, let me also reassure you that we in WHO are doing our part.
And we hope that the Paris Agreement is going to give us an even stronger mandate for action together. For our keynote presentation, I have the honor of introducing Professor Sir David King. Sir David was appointed as the UK Foreign Secretary's Special Representative for Climate Change in September 2013, and has previously worked with Prime Ministers Tony Blair and Gordon Brown as the government's Chief Scientific Advisor. He has been instrumental in raising awareness of the need for governments to act on climate change.
It's a privilege to be here with you, and it's a very, very important topic that I'll be addressing. I'm going to start with what I think is Europe's biggest single natural disaster measured in terms of the number of fatalities. And that was the hot summer of 2003. The best estimate of the number of people who lost their lives across Europe in that hot summer is 65 to 70,000. It was an enormous loss of life. It's not recorded as a natural disaster because, unlike a tsunami, it happened over months, or a month and a half rather than over a day. But nevertheless, in terms of the number of people who were lost in that disaster, it was enormous. Now, the question I'm addressing here is, what is the impact of climate change on human health? And I'm now going to suggest to you that that disaster was the first direct climate change implicated disaster. So what I'm showing you here is as a function of time going back to the year 1900, the average Central European summer temperature. The black is the measurements, and the red is the theoretical analysis provided by the British Met Office to me in that year, 2003, where there's a black line that comes up to a cross. That's that extraordinarily hot summer in 2003. Now, I hope what you can see from that is that it was well in excess of the previous hot summer in Central Europe on record, 1947. That spike in 1947. And then in red, what you see is the Met Office's theoretical model. And that theoretical model from the UK Met Office is essentially from our world analysis of the weather. It's an enormous amount of data, an enormous computer program. It is reinitiated every 6 hours from data gathered from satellites and from commercial aircraft around the world, every 6 hours. And we predict the weather for the world tomorrow. And we also predict climate change for the world in 80 to 100 years' time. So this model includes greenhouse gases. And I simply asked the Met Office to run the model backwards in time, first of all, to see, and I was asking them in 2003, to see to what extent we could trust the calculations. And you'll see that the red indicates that this doesn't give a bad description at all of the change in the Central European average summer temperature going back to the year 1900. What, of course, it doesn't show is that we can predict the weather. The weather is the spikes going up and down over that length of time. The weather prediction is pretty good for tomorrow, and it gets worse and worse as we go forward. And so what I also asked them to do was to reinitiate their program over a 6-week period. And so what you see in the different red curves is the up and down of the weather as predicted, and the overall trend is what we are now calling climate change. Now I asked them to run the program forward in time, and you can then see that you can then see, if you glance across, that by 2050, on a not business as usual, a medium to high emission scenario, which we're currently on, we will have reached, as an average temperature in Central Europe, the same as that extraordinarily hot summer in 2003. And that, to me, summarizes the enormous risk we are faced with from climate change. Each and every population around the world is fully acclimatized to their historical climate. And we would never have had that number of fatalities if people had been acclimatized to the average climate. But that rising background signifies the challenge that we're faced with. When we get an extremely hot summer in 2050 or thereabouts, that'll be an equal spike, but sitting above a much higher baseline temperature. There's the challenge. And you will see from this that we need to be, in the shortest possible time, decarbonizing the global economy. And that's what this meeting here in Paris is aiming to do. Now, was that a curious event? Of course, we always have extreme weather events. Those upward spikes indicate that in the black curve. But let me just then take you to the next slide, which shows you that hot summer on the left in Central Europe in 2003, and then in July 2010, that awfully hot summer that the Russians around Moscow suffered. And you will see that the Moscow temperature was considerably in excess of that we experienced in Central Europe. And that's the kind of challenge that we are faced with in terms of the human capability to survive going forward. When I was Chief Scientific Advisor, what I had to do was worry about the low probability events, which these extreme events are, with a high impact. And a low probability event might be an event up to 1%, but if the impact was a severe loss of human lives, then we had to act. So, for example, H5N1 flu, when it developed in sectors of the avian population, the question arose whether it could transmute into a virus that would become a human-to-human avian flu virus. And since human beings have no protection against H5N1, the outcome would be severe. So I had to get together a group of biologists to first of all give me an indicator of what the percentage chance of that transmutation was. And they said over 10 to 20 years it might be 1%. That's in my danger zone. Then I said to epidemiologists, if this transmutation happens anywhere in the world, how long before it arrives in Britain? And it's amazingly quick because air flights are the best means of transporting a virus of this kind. And after that, what would Britain's population impact be 6 months later? And the answer was between 500,000 and 1 million fatalities, 500,000 to 1 million deaths in just the first 6 months of this flu outbreak. So what I did was then go to a major pharmaceutical company based in Britain. I won't advertise which one. And I simply said, what would it cost to develop a vaccine against the avian H5N1 virus? They gave me a very large number, and I took it to the Prime Minister and the Cabinet, and they agreed right away that we should develop the vaccine and vaccinate the British population up to about 80% of the population, which we did. All right, so now I take climate change, and as I moved into the Foreign Office, decided I would start a new exercise. And that exercise was not to say, what is the average impact from climate change likely to be going into the future, but what are the 1% impacts, and what would the outcome be of those impacts? And what I did was simply put together a team of about 120 political advisors, high-level politicians, people from the security sector, admirals and generals from the United States, India, China, and Britain. And we worked for about a year, and we had meetings in each country. And the outcome has been published. It's available on a website. It's a risk assessment of climate change. Now, a risk assessment is taking an insurance/reinsurance approach to climate change, which frankly has never been done before. And this is like saying to somebody, do you have insurance against your house burning down? And everyone would say, of course I do. Do you expect your house to be burned down? Absolutely not. But the outcome is so severe that you take out an insurance policy. So this is what we were doing here. And so what we did was ask, for example, very high-placed Chinese experts, what is the biggest challenge that your country is faced with? What could climate change throw at you? And they came up with 3 things, and I'm just going to run through our analyses of the risk of each of those occurring going forward in time. And the first was complete failure of the 3 major rice crops in China in 1 year. And if I could have the next slide, we see that, I'm sorry that the yellow curve doesn't come up too well, but these are the different crop varieties, and the temperature rise, local temperature rise, is shown along the bottom curve there, and the local temperature rise above today's level, let me stress. That's not using the pre-industrial level. And you'll see that as the temperature rise even goes to 0.5 degree or 1 degree, the risk of failure of the rice crop in China that would be devastating for the population is already approaching 1%. That's a major risk for a population to take. But let me stress, this is just one impact, because climate change is driving impacts all through together. As the temperature rises to 2-3 degrees centigrade, any biologist would know a rice plant as it flowers is very sensitive to excessive temperature, and if the temperature rises above 34 degrees centigrade, it doesn't produce the rice fruit. Right? So it was a relatively easy calculation to produce this. What this means is food crops around the world are beginning to fail at about the same time because there's a common driver throughout the world. Let me just take the next slide, which gives what is the risk of fatal heat stress? That's what people suffered from in Central Europe. And if we look at this curve, it says, well, if the global average temperature increase is below 4 degrees centigrade, it's below the 1% risk level. And those two disasters I started with, 2003 and 2010, are below that 1% risk level, but they happened. You'll see that as the temperature rises above 4 degrees centigrade, this curve takes off to enormous proportions. It's saying that in any 1 year, we're approaching 60%, 70% chance of this happening. Now, obviously, this is a fatal prediction for many societies. Please look, I'm looking here in blue at northern India, in orange at southeast China, and in green at southeast United States of America. Fatalities for people without air conditioning would be in hundreds of thousands with this sort of situation. One of the biggest risks is, of course, from rising sea levels. The British Isles is a particular situation. Every island nation is faced with this. When there are storms at sea, we have storms inland as well. It means our rivers are swollen and flooded at the same time as we get attacks around the coastline. And the cities, 80% of the world's major cities are based on coastlines, are under severe risk of flooding during those extreme weather events. And all we're showing here is the number of events per 100 years that would occur in Calcutta, Shanghai, and New York. And you can see from the figures showing Calcutta, by the time you get to 100 per 100 years, it's saying Calcutta will flood every single year on average. And this curve rises well above that level. The sea level rises are between 0 and 1 meter on this curve. The very cautious prediction is that we will be approaching 0.4 to 0.5 meters by the end of the century. That's not taking into account feedback effects that are already being observed on Greenland. So as we go forward, actually, it's clear that Calcutta is not a city that can house people as we go forward above sea levels rises of 0.5 meters or so. We published this, as I said, in June, and some of you may be aware of the very severe floods suffered in Calcutta shortly after we published this paper. If you follow that green curve back in time, you'll see that it's a non-zero probability of happening. The severe floods of cities around the world is happening at the same time as these other challenges. But then let me go back to food production in China and the dependence on rice as a crop. The biggest rice paddy fields in the world are in the Vietnam Delta. And that delta is going to become salinated as sea levels rise, particularly when there are storms at sea. And we will lose the rice crop from the biggest rice crops in the world, and that will be a loss that will not be regained. So we're looking at severe challenges to the global economy going forward in time. What is the probability? I was asked to talk about less than 2 degrees centigrade. What's the probability going forward in time that the temperature will stay below 2 degrees centigrade? These different curves are the Intergovernmental Panel on Climate Change, different scenarios going forward. The best case scenario, and we've got to work like hell, if I may say that, to get on the best case scenario, is the dark blue. And you'll see that the dark blue is saying that even as we get to 2030, there is a very good chance that we will exceed a 2 degrees centigrade rise. Even in the best case outcome from this meeting and better behavior going forward in time, we see that that probability is well above that 1% level that I mentioned. Let me have the next slide, because then it says what the probability of exceeding 4 degrees centigrade is, and you'll see that beyond the middle of this century, on a business as usual, it's going to go above 4 degrees. The dark blue is that best behavior curve. We've actually got a pretty good chance of staying below 4 degrees as we move forward in time. We're hoping that we will stay on the pale blue curve as we move forward from this meeting, or the dark blue. But let me just remind you, we cannot predict that'll be certain to keep us even below that 4-degree level, which I'm saying is going to be devastating. The conclusion from the University College London Lancet Commission report, that joint study, which came out about the same time as our risk and assessment analysis, is shown here. Climate change is the greatest global health threat of the 21st century. I hope you understand. I believe that climate change is a threat to our global civilization. Our economic system cannot survive the kind of threats we've understood from this analysis. Thank you very much.
I think it brings home once again why we're here today, what we need to do when we go back, and the disastrous consequences if we do not carbonize our economy in the shortest time possible.